Hi everyone. Today in this session, we're going to be talking about menopause and bone health, and we're going to look at how diet can play a role in protecting our bone health. Bone health is really important, especially as we get older. As we get older, we're at increased risk of developing osteoporosis, and osteoporosis is also known as brittle bones. Now, lots of things can affect our risk of developing osteoporosis, things like genetics, as well as other lifestyle factors. But estrogen, that hormone, is also really important for protecting our bones. And then when that estrogen level starts to decline, especially after around the time of menopause, we are at an increased risk of developing osteoporosis. So what's happening with osteoporosis? As you can see here on the right, this is just the inside of our bone. And inside our bone, you can see it's almost like a honeycomb. This honeycomb here is the makeup of bone. But if we develop osteoporosis or brittle bones, you can see here that that honeycomb starts to break down and there can be wide gaps and different things like that in it. That makes the bone tissue much weaker and more brittle, so it's more inclined to break. And that can lead to things like fractures and bone breakages. So what's happening with regards to bone and bone health throughout our age, as we age? So you can see here in this graph that as we are children and teenagers, our bone mass is constantly increasing. And this bone mass is really about the density and the strength of our bone. And as we are kids and grow into teenagers and adults, that strength is getting stronger and stronger. And that's all to do with our genetics and our foods we're eating and our physical activity. And you can see here around the age of 35, that is when our bone mass is at its peak. That's when it's kind of most dense and most strong. And then naturally, as we age, that starts to decrease. So as we get older, our peak bone mass naturally starts to decline. But what you can see here is that for men, this tends to go down in this gradual fashion here. But for women, it becomes much more pronounced around the time of the menopause. And that's because at the time of the menopause, we see these big declines in estrogen. And estrogen plays such a huge role in maintaining our bone health. So as estrogen levels start to decline, it also then has an impact on bone health. So it's really important for women to look at lifestyle and lifestyle factors to maintain their bone health and keep those bones healthy for as long as possible. So looking after our bones, there's lots of different things that we can do. Of course, if you have any concerns at all, it's really important to speak to your doctor. They can also prescribe medications, particularly if you're at increased risk of osteoporosis or osteomalacia. And they can also do scans and different tests to look at your bone health. But when it comes to lifestyle, it's important to look at other factors. Of course, what you're doing with this program is brilliant. The exercise component is going to really help strengthen your bones. Other lifestyle factors are important too. Alcohol and smoking both can have a negative impact on our bone health. And that's because in our bones, we also have what's called collagen, and collagen is really important in maintaining our bone health. And it's thought that both alcohol and smoking actually interfere with making collagen in our bodies and therefore has a big impact on bone health. So if you drink in moderation, and again, if you're drinking in moderation, to maybe drink with your meals, that's really important. And the recommendation for alcohol intake is around 14 units per week for women. If you smoke, it's really important to maybe think of, if you're thinking about quitting, to have a chat with a cessation officer, or there's lots of information on the HSE website and the Department of Health website on quitting smoking. But when it comes to diet, there's three nutrients that are really important in looking after our bone health. There's calcium, there's vitamin D, and there's protein. Calcium, as we saw from our healthy eating talk, is on the dairy shelf. And it's really important for women to eat 3 servings of calcium-rich foods every day. And that can come from things like dairy foods, such as milk, cheese, and yogurt. But you can, of course, use your dairy alternatives, such as your soy products, but just make sure that those products are fortified with calcium, because calcium is not naturally present in those sorts of foods. But again, to make sure you're trying to incorporate those into your daily diet. Other really good sources of calcium are things like canned fish with edible bones. So your tinned sardines, your salmon that have the soft bones in there, really great sources of calcium, and great for things like quick lunches and even for snacks. Green vegetables, such as broccoli and kale, and sesame seeds, such as almonds and chia seeds and sunflower seeds. These are really good sources of calcium as well. They are not as rich as the dairy sources, but they can really help contribute to your overall intake of calcium. Also, if you're a fan of breakfast cereals, if you are picking a breakfast cereal, look for ones that are fortified. Again, they tend to have calcium added to them, and again, can contribute to your overall intake. Next nutrient is vitamin D. Vitamin D is really important for bone health, because what it does is it helps our bodies to absorb calcium into the bones. So calcium, we can eat calcium, but we need vitamin D for that calcium then to work in our bodies. So we need to incorporate both in our diets for it all to have an effect on our bone health. We can get vitamin D from the sun, but it's important to remember, because of where we are in Ireland, we don't get enough sun to make vitamin D, especially after Halloween and up until Paddy's Day. So between Halloween and St. Patrick's Day, the sun is at such a low latitude that we actually can't make vitamin D from it. So it's really important to include vitamin D in your diet or in a supplement, particularly during those months. But even during the other months of the year, not that we always have an awful lot of sun, but even if we do, we tend to wear things like sun cream. And of course, that is really important for protecting against skin cancer, but it means then that we are not being able to make vitamin D from the sun. So we need to get vitamin D from our diet, or we need to get it from our supplement. Now, when we look at vitamin D in the diet, the thing with vitamin D is that it's not found in a huge amount of foods. It's found in things like oily fish. There's small amounts in red meat. There's plenty of vitamin D in liver, but not everybody's a fan. You also get vitamin D in egg yolks, and you also find it in fortified foods such as fat spreads and some breakfast cereals, again, if it's been added in by the producers. Milk itself tends not to have much vitamin D in it, but Supermilk has added vitamin D in there too. And it's brilliant to see that companies are now also incorporating vitamin D into their products. For example, you can now get vitamin D enriched mushrooms, which would never have really been a good source of vitamin D, but now they contain vitamin D in there. So for a lot of people, if they don't like things like oily fish, it can be hard to get vitamin D into your diet, and to get enough vitamin D into your diet, because these are not necessarily foods that people eat an awful lot of. And if that is the case, it's important to consider having a vitamin D supplement, and to look out for one that has about 10 micrograms of vitamin D in it, especially during those winter months. The other nutrient to look at is protein. Protein is really important for our bone health. We usually associate protein with muscle, but it has lots of functions in our body, including looking after bone health. Now, we do eat enough protein. Most people in Ireland eat more than enough protein, but we tend to maybe concentrate it in one main meal per day, or maybe two. And what we do know from the research is that if we break that up throughout the day, if we have protein, say, incorporated into our meals and maybe some of our snacks, it actually works better in our bodies. So by having protein throughout the day tends to work better. And again, that's going to also have an impact on our bone health too. So thank you very much for listening, and we'll catch up soon.